I would like to use this case that I'm doing the quality control to evaluate the outcome of the first set of aligners, a case that we treated with aligners, to explain the importance of using the Airway as a big reference when you are planning your ortho cases, not only with aligners, for any kind of system. Okay, this patient has a class 2 second division that normally I saw a lot of doctors treating by distalizing, doing distalization of the upper arch, okay, and bringing this cuspid to class 1, okay. But we have in this example, in this patient, the two main factors that can cause airway issues: sleep apnea, posterior obstruction of the airway, and they are the retrognatic mandible. Okay, we can see that the class 2 second division with the retroinclined incisors are avoiding the mandible to position better. Okay, this is something that we can check in her profile. Okay, her profile has a good angle between the upper lip and the nose, a good position of the maxilla. So the problem is not in the upper arch, and this is very important for us to understand from the beginning. Okay, every time you can see that the upper arch is in a good position to the face, to treat a class 2 patient is not by retracting the upper. Okay, and by not retracting, we are also not going to reduce space. Okay, and not going to keep blocking the mandible back, which is a number one cause for airway issues. Okay, the second, we have in this patient reduced distance in the interpremolar and intermolar. Okay, let me put in a better view for you. Okay, but in between the premolars we have less than 20 millimeters, and the ideal minimal distance would be 27. Okay, and here in between the molars we have 32, a little bit less than 34, which also will be ideal. So narrow maxilla and retrognatic mandible are the two main factors. So for this case, we didn't want to correct by retracting. Actually, we move forward, we proclined, we expanded, we create space so this patient can have more space for tongue. And most important, with this position that we plan, I'm going to remove the initial model and leave only the final design and bring here, let me bring back. So by doing this, okay, we are going to create an overjet that allows the mandible to move forward, and also with this expansion we open margin for us to also improve the shape of the lower arch. Okay, this is something, this expansion would work very fine for her, because looking to her smiling picture, a little bit shy, she doesn't show a lot of her posteriors. Okay, so here in this photo we can see that we have a lot of margin, and it is interesting for her to expand, so we are going to improve aesthetics and also space. Okay, so with this idea in mind and this plan that we performed, we procline out the upper, procline incisor, open space, and the outcome we achieved so far comparing upper and lower. Okay, let me bring here again and bring. So this is the outcome we could achieve so far. Okay, very close to the plan after one set of aligners. Okay, we could expand even more than it was originally planned. We could solve the space, we procline anteriors, and this movement that we did with ortho, this improvement when we compare with the lower arch and bring the lower. Let me put in the profile view, which is more interesting for this case. Look the difference here between the incisal edge of the upper incisors with the pro-inclination, okay, and the lower jaw that was retrognatic. Just by opening space, what actually happened in the end is that the mandible advanced. Okay, so you can see here between initial and final, initial and final. Okay, and just seeing the mandible, we could achieve almost 2 millimeters or even more in terms of forward movement of the lower jaw. And this is very important to improve quality of life of the patient, opening more space, avoiding airway issue, a very young patient that we don't want to cause that, and most important, to improve her occlusion, because without doing any retraction of the upper arch, just respecting the airway aspects and the face aspects, we could allow the lower jaw to move forward and bring her to this great intercuspation. Okay, we still need to do some minor fine tunings for additional set of aligners, but she's now a class 1 patient, only with this functional movement of the lower jaw. And besides that, when we can check her smile, we can see that the improvement in terms of aesthetic is amazing. Look how harmonic it is, look how the posteriors are feeding the buccal corridors, and this is a real great improvement for this patient. Okay, we are talking about aesthetic improvement, airway improvement, okay, quality of life and functional improvement because the patient has a more stable occlusion. So my tip for today, okay, when planning class 2 cases, do not start thinking on the usual biomechanics you are used to it, okay, because a lot of the cases the upper arch is good according to the face, and the problem is it is in the lower arch. So when you plan your case respecting these aspects, respecting airway, and you can open space to allow the lower jaw to move forward, good things will happen, and the patient will thank you later because it will be much more stable. Okay, I hope you like this tip, and I hope to you are enjoying these videos, and let's keep in touch. Bye bye.